This presentation is about the cooperation between physiotherapists and hemophilia treatment center and in primary care. First, I want to give you a short introduction about hemophilia. Hemophilia is an hereditary genetic blood clotting disorder leading to bleeding into joints and muscles. Patients with hemophilia experience on average 3 bleeds per year, of which 60% are joint bleeds. These bleeds can occur without clear cause, trauma-related, or after a surgery. Recurrent bleeding into a joint leads to hemophilic arthropathy. Especially older patients that did not have the right medical treatment when they were younger experience advanced hemophilic arthropathy in multiple joints. Unfortunately, bleeding still occurs in younger patients as well, eventually leading to hemophilic arthropathy. Physiotherapy is therefore highly recommended in this population to regain physical functioning after bleeding and to maintain physical functioning in hemophilic arthropathy. Hemophilia is a rare disease with a prevalence of 1 in 10,000. Between 5 and 8,000 rare diseases are described. That covers between 6 to 8% of the population. That are in Europe between 27 and 36 million persons. So to give you an impression, this is about the same amount of persons that have diabetes. So actually, there are many patients that have a rare disease. Therefore, in 2009, the European Union decided to designate so-called expert center for rare diseases. It was to improve the quality of care for patients with rare diseases. These expert centers work together to improve the quality of care and research in European reference networks. These expert centers for hemophilia are called hemophilia treatment centers. In the Netherlands, there are a few hemophilia treatment centers. Our center in Utrecht is in the middle of the Netherlands. And as you can see on this map, patients that go to our center come from all over the country. The average distance to the clinic is 68 kilometers, and about 30% of the patients has to travel over 1 hour to go to the clinic. For Dutch standards, that's a long distance. So if we then look at the European map, we see that the distance to a hemophilia treatment center in other European countries is similar or even bigger than in the Netherlands. So therefore, patients with hemophilia often rely on primary care for the physiotherapist. But because of the rare nature of hemophilia, primary care physiotherapists generally have had minimal specific education about hemophilia during their training. They also have limited experience with hemophilia, as most primary care physiotherapists see not more than 1 patient with hemophilia in their entire career. The aim of this study is therefore to evaluate the cooperation between physiotherapists in hemophilia treatment center and in primary care, and also to provide recommendations for the improvement of the quality of care. We did that first by sending out questionnaires to primary care physiotherapists, to persons with hemophilia, to physiotherapists working in hemophilia treatment centers. Subsequently, we invited a subgroup of the stakeholders for a focus group. Results from these questionnaires in this focus group show that between 38% and 44% of the primary care physiotherapists felt that they had insufficient knowledge and experience to treat these patients with hemophilia, depending on their specific complaint. Also, 32% of the patients with hemophilia felt that their primary care physiotherapist lacked knowledge about their specific disease. The stakeholders, and especially the persons with hemophilia, were in general positive about the collaboration between physiotherapists in primary care and hemophilia treatment centers. So based on these questionnaires and this focus group, we formed 5 recommendations. The first recommendation is to develop a formal guideline for the physiotherapy treatments of persons with hemophilia in primary care. Furthermore, there is a need to improve the reimbursements for primary care physiotherapy for persons with hemophilia by insurance companies, because currently there is no specific reimbursements for this group. There's also a need to ensure that there is a low threshold communication between the physiotherapists in primary care and in the hemophilia treatment centers. There's a need for a website with up-to-date information about hemophilia, but also, for example, with contact details of physiotherapists working in hemophilia treatment centers. And at last, there's a need for a decision tool to support primary care physiotherapists to decide when a patient with hemophilia has to be referred back to the hemophilia treatment center. So to conclude, the collaboration between physiotherapists and hemophilia treatment center and in primary care is essential to assure a high quality of care for patients with hemophilia. But in future studies, we should confirm whether the recommendations from this study also apply to other healthcare systems and other rare diseases. Future studies should also confirm whether the implementation of these recommendations indeed lead to the improvement of quality of care. I want to thank you for your attention, and I also want to thank my colleagues for collaborating on this project.